Umakyat ulit sa mahigit 5,000 ang aktibong kaso ng COVID-19 sa Pilipinas ayon sa Department of Health. Pinakamataas po yan mula noong May 3. Kasunod yan ng naitalang halos 600 bagong kaso kahapon. Pinakamarami ang new cases sa Metro Manila. Nauna na rin sinabi ng DOH na nakitaan na ng significant increase ang mga kaso sa rehiyon. Para mas maintindihan po natin kung ano ang ibig sabihin nito at ang COVID situation ngayon sa bansa, makakausap natin live si OCTA Research Fellow Professor Guido David. Magandang umaga, Professor.
Yes, magandang umaga, Gretchen, at sa mga nanonood sa atin sa frontline.
Okay, sa mga nabanggit po natin na numero kanina, sabi po ng DOH na significant na raw yung increase ng COVID cases sa NCR. Tama po ba yung assessment na yon at ano po ba yung implikasyon nito?
Yes, Gretchen, tama. Yung increase sa Metro Manila, kung titingnan natin yung one-week growth rate ay 89%. Meaning yung 7-day average ng cases natin sa Metro Manila, ngayon nasa 264, mas mataas ng 89% sa 7-day average ng nakaraan na linggo na 140. Anong ibig sabihin nito? 89% is a big increase. Halos dumoble siya kumpara sa nakaraan na linggo. Nagre-reflect din yan sa reproduction number na nasa 2.01 sa Metro Manila. And yung positivity rate tumaas na to 5.5% sa Metro Manila. So tumataas yung indicators. Of course, yung most important indicator, yung healthcare utilization, ay still at low risk dahil nasa 21% healthcare occupancy sa ngayon.
Okay. Sa ibig sabihin po ba ng significant ay dapat rin po ba tayong maalarma? Kasi eto nga po, sabi nyo, 5.5% ang ating positivity rate ngayon, pero low risk ang healthcare utilization rate. Saan po ba tayo magbabase based on being alarmed again with what's happening to our COVID situation?
Yes, Gretchen, and that's why it's important to put proper context dito. In terms of being alarmed, hindi tayo alarmed kasi mababa yung hospitalization. Ganun din yung nakita natin noong January. So pag Omicron, most cases are mild, so konti lang severe. So we don't expect na mapupuno yung hospitals natin. That being said, we have to raise awareness pa rin dahil personal responsibility here is very important. Dahil hindi tayo magsasarado ng ekonomiya natin because we need the economy to be functioning. So hindi tayo mag-raise ng alert levels, not at this time. Pero we have to have personal responsibility kasi meron tayong mga kababayan na yung mga seniors or may mga comorbidities and they need to be protected pa rin kahit na vaccinated sila. It's better for them to know na cases are rising and they should be looking out for themselves. Ganun din may mga kasama sa bahay na seniors o may comorbidities. They should be looking out for their yung mga seniors. And so we should do practice safety methods, protocols to make sure na hindi natin sila madalhan ng virus itong mga seniors and may comorbidities.
Okay, Professor, ito pong mga numero nakikita natin ay hindi pa po kasama yung mga hindi nagpapatest. Medyo marami-rami po yan, ano? Ano po ba yung percent discrepancy po natin dun sa mga actual numbers and yung nakikita lang po natin dun sa daily data natin? At sa pagtataya nyo po ba, posible pa bang lumagpas sa una ninyong projection ang magiging cases sa peak ng surge?
Well, Gretchen, yung 264 cases reported yung 7-day average sa Metro Manila. And actually, yesterday sa Metro Manila, we had 304 reported cases. Hindi yan yung actual number because maraming nag-home test, nagpapa-antigen test, or yung iba hindi man nagpapa-test, may mga asymptomatics na hindi nila alam na may COVID sila. So the number is usually much higher than what is reported. Unfortunately, wala tayong data on what the discrepancy is unless we conduct some random antigen testing tulad ng ginagawa ng DOTR nung January. Pero during that time, na nag-conduct yung DOTR ng random antigen testing sa MRT, they found or at least we determined na yung actual numbers about 5 to 10 times higher than what is being reported. So that could be, we could use that as as a starting point to estimate kung ano yung actual number of infections. It could be 5 to 10 times higher. Again, This is just a very rough estimate of kung ano yung mga actual numbers since we don't have any information. Pero yung projections natin, we're still projecting about the same number na this is going to be a mild or a weak surge. Now, we might reach a few thousand cases per day during the peak, which might happen first or second week of July. But it won't be as bad as yung surge natin in January or even the surge last year ng Delta or yung Alpha and Beta, primarily because marami na tayong vaccinated, so we can manage this without escalating the alert levels.
Kailan po ba inaasahang sasampa sa moderate risk ang NCR? Kasi nga po, meron po kayo nababanggit, yung healthcare utilization rate mababa. Yun nga lang, pagka nagkakasakit po yung workforce natin at dumadami yung kaso, marami naman pong apektado na businesses. So, kailan po ba tayo maaaring magdeklara ng moderate risk at alert level 2?
Yes. Well, Gretchen, yung alert level 2 usually as we mentioned, depend yan sa healthcare utilization. I don't have the metrics used by IATF and DOH for escalating to alert level 2 since sila yung nag-de-escalate or nag-escalate. I tend to think na pag nag-increase yung hospital utilization maybe to around 40, 50, I think 50%, then we might escalate to alert level 2. Pero right now, 21% hindi naman masyadong tumatas yung healthcare utilization. So, it could take a while or baka hindi man tayo mag-escalate to alert level 2 because if cases are going to reach just a few thousand, I don't foresee na our healthcare utilization will reach 50%.
Sabi nga po ng iba, kailangan na natin matuto to live with COVID. Pero ano po ba yung reaksyon ninyo dun sa mungkahi ng ilang government officials na dapat na tayong magbigay ng second booster sa economic frontliners? Kasi parang sa aking pagkakaintindi, hindi pa ito recommended dahil wala pang datos na nagsasabing kailangan ng second booster. Kaya sa immunocompromised at frontliners pa lang siya pinapayagan. So ano po yung opinion po nyo tungkol doon?
Well, actually, tama ka, Gretchen, and I concur. Yung pag-recommend ng second booster shot, this will depend on the recommendations of the medical experts and the doctors. Pinag-aaralan nila ito, and this is usually based on studies and based on data. Kasi hindi naman nila basta-basta nire-recommend yung second booster shots. That being said, I think in other countries, they have recommended second booster shots. At least for the yung 50 and above age group. So it could be something that they could consider. Of course, it depends on yung studies nila. But that being said, Gretchen, isa nating problem is mababa yung first booster coverage natin. Only about 20 million. I think that would be around 20% of the population with the first booster shot compared to 70 million na fully vaccinated. So I think since marami tayong vaccines, since the first boosters already given to the general population, I hope na marami tayong mga kababayan who will take the first booster shots kasi marami tayong supplies ng vaccines na baka mag-expire na lang, sayang naman, at saka na-recommend na rin naman ito ng ating mga medical experts.
Oo nga po one problem at a time nga po. Maraming salamat Professor Guido David ng OCTA Research at magpa-booster na po tayong lahat.